evening. I'm Pinky Webb. Tonight we get On Point. For many women, the thought of undergoing major surgery brings anxiety over pain, long hospital stays, and massive surgical scars. But medical technology has shifted dramatically, with one Philippine hospital performing more than 3,000 robotic-assisted surgical procedures. This milestone makes St. Luke's Medical Center the undisputed leader in the robotic surgery in the country. How does this procedure actually change the outcome for women's health? Let's get on point with Dr. Victoria Cruz-Javier, head of minimally invasive surgery and robotic surgery at St. Luke's Global City, and also with us Dr. Josefina Morales, clinical head for patient experience at St. Luke's, Quezon City. Dr. Marie and Dr. Ado, may I call you that?
Yes.
Welcome to the show, and thank you for your time.
And thank you for having us.
Very
Pleasure
welcome.
to be here.
You know, when they talk about, when we hear robotic surgery, one thinks that, it's advanced, it's high-tech, but also there's that fear of the unknown, because some might think that it's a robotic surgery working independently or not. There's a lot of questions regarding robotic surgery. Dr. Marie, what is robotic surgery for us who, in layman's terms?
In layman's terms, so actually, robotic surgery is a form of minimally invasive surgery. So it's very much similar to laparoscopy, but with certainly with advancements. So it seems very impersonal, no, and intimidating kasi parang robot. But it's just a tool. It's a technology. It's still the surgeon who controls the robot. Of course, there are several advantages with the robotic surgery.
Okay. And how does this specifically work in the field that you're in, especially gynecological surgery?
So in gynecology, the advantages of the robot would be the use of the magnified three-dimensional view. Okay, here we're able to see the tissues, the structures more clearly. And apart from that, the dexterity it offers. Okay, so with the traditional laparoscopy, we use straight fixed instruments, whereas in robotic surgery, the range of motion is endless.
Yeah.
You can do almost anything. And apart from that, the robot also filters out the natural hand tremors.
Really?
Yes, it does.
I
yes,
see.
It does.
Okay.
So
I'm
it's
actually
more-
watching some of the videos. Okay. So, you're saying in layman's terms, yung mga panginginig, na-avoid yan
Nawawala.
ng robotic surgery.
Yes.
I see. Okay. And then?
Nawawala. So it's like when you think of the robot as an extension of the surgeon's hands, where every single movement of the surgeon will be translated into miniaturized motion inside the patient's body. It's like you're really inside the body of the patient and you're able to see the structures more clearly. So, and you can do fine dissection.
I see. Okay. Among women, what is the most common gynecological issues affecting Filipino women today, Dr. Marie?
Usually, the most common would be like myomas, endometriosis, mga ovarian cysts, and usually the more common procedures that we perform via robotic surgery are myomectomy and hysterectomy. Even yung mga advanced removal of ovarian cysts. So, if I may add also, Pinky, the additional advantage of robotic surgery, kasi itong the surgeries that I've mentioned are advanced procedures, no? So, with the advantages, according to Dr. Ado, with the robotic surgery kasi, how does it translate to patients, diba? So, since the movements are fine, it's even more precise surgery, there's less tissue trauma.
I see.
Kasi like very fine ang movement, the instruments, the arms are fixed in the abdominal cavity. Somehow the movements are very, very minimal and the hand seems to be inside. Hence, there's less tissue trauma, so less pain. So, in effect, when you have a patient comparing open, laparoscopic with robotic surgery, it's really superior.
Okay, because I was going to ask exactly what kind of conditions can be addressed by robotic gynecology, and you mentioned that a while ago. So what is it from the, pag sinabi kasing minimally invasive, ano yung pwede niyang gawin as minor and pwede niyang gawin as major surgery using robotic surgery?
So the same. So like my removal of ovarian cysts, removal of myoma, hysterectomy, even cancer surgeries can be performed via robotic surgery. So instead of having a long incision, so you have just like 8 mm incision sa abdomen. So in effect, so syempre, with the smaller incision, less yung pain, less yung risk for infection, better recovery, better quality of life.
Is there an ideal candidate for robotic surgery? Is there such a thing?
Okay, comparing laparoscopy with robotic surgery in terms of routine, straightforward cases, the outcomes are the same. But the advantage of the robot really plays, you'd see the advantage of it in terms of complex cases. And so what are these cases? First, if you're dealing with obese patients, okay, if there is complex anatomy, like let's say that there's deep infiltrating endometriosis, multiple myomas, extensive adhesions because of previous surgery, the added dexterity and visualization of the robot makes these technically difficult surgery more feasible through a minimally invasive approach instead of converting to open surgery.
And obviously, one would assume it's safer. That
in
would be
terms
the
of
safer way.
yes, it's in terms of complication like infection, kasi hindi mo bubuksan eh. And also pain, the use of anesthesia, analgesia, the requirements are low because again, smaller ang incision, less tissue trauma, less yung pain. So patients are much happier with robotic surgery talaga.
Okay, a while ago you talked about, I wanted to circle back to what you were talking about, that 3D visualization. You mentioned that a while ago, and wristed robotic instruments. Can you explain that to us? Ano po yung 3D visualization and wristed robotic instruments?
Okay, with 3D visualization, you're also able to assess the depth perception. You're able to see the structures more clearly. You can zoom in and zoom out. For instance, you can see the borders of the lesion much clearer. Now, in terms of dexterity, for instance, the range of motion, it mimics the wrist and even does more. Like, for instance, we can only twist our wrist this much, but with a robot, it can go as far as 540 degrees.
Really? So instead of maybe like a 180 twist, you can do what, 360? You can go completely.
And then remove your hand from the control and then twist
I
again,
see,
so
you
that's
can do that.
540.
Wow, that must be very exciting.
It is
for
actually.
you
Yes,
doctors,
it is.
right?
It is actually.
And how does one train to be able to do this? Does it take a lot of training, a lot of studying, seminars?
Yes, it actually, of course, there's always a learning curve in any, I can't call it new, because the robotic platform has been, in worldwide more than 20 years, 2001.
Wow.
In the Philippines, St. Luke's has 15 years of experience in robotic surgery. So, of course, there's a learning curve, and also actually, of course, you have to learn, you have to study everything from the principles of doing surgery and adapting to the platform. So, yes, it entails a lot of training.
I'm sure before when it started, as Dr. Marie mentioned a while ago, 20 years ago, and then St. Luke's introduced this 15 years ago, 5 years later when it was introduced to the world, you must have been so excited about this and to be able to perform this to your patients, because it's certainly minimally invasive. Less tissues will be damaged. That's great for all of us, those who may have to do surgery with the OBGYNs. I just want to talk about the kind of training you guys go through. If you can just maybe elaborate more on that. Gaano kahirap yung training?
So, we were saying, before we started doing robotic surgery, we were both laparoscopic surgeons. So, we do laparoscopy. So, there was one question. So, it must have taken you a long time to adapt na you're not inside the patient's abdomen, you're far away, there's a monitor. But truth of the matter kasi, like in St. Luke's, we're heavy on minimally invasive surgery to begin with. So prior to the robotic surgery, we were doing laparoscopic procedures. So the transition was actually, of course, transitioning to the use of the platform. So We actually, initially when it started, so we had to train abroad and have exposures on the robotic platform. So it entailed continuous education, training, courses, and even after now, we also adapt because there's several models available. There's actually advancement in the machine. So we really study. We don't stop actually.
And the advancement, can you talk about that? What kind of advancement do you look forward to, or are we seeing in terms of robotic surgery?
So the robot can be also used for certain malignancies like uterine cancers, okay, and this would include lymph node dissection. So in we also are able to do cervical cerclage. This is a treatment for those with recurrent pregnancy losses.
I see.
Okay, and for deep infiltrating endometriosis, the robot is able to access hard to reach areas of the pelvis. So this is again this is again an advantage because we're able to excise all the lesions there. And in multiple myomas, with use of laparoscopy, it's difficult to put back the layers. But since here you can really move like the human hands, so you're able to close the uterine layers much carefully and meticulously.
All right, we need to take a very short break. We'll continue our discussion. Stay tuned. This is On Point. All right, welcome back. Still with us, Dr. Victoria Cruz-Javier, head of the Minimally Invasive Surgery and Robotic Surgery at St. Luke's Medical Global City, and Dr. Josefina Morales, clinical head for patient experience at St. Luke's, Quezon City. St. Luke's, according to reports, hit a major milestone with 3,000 robotic surgery cases. Tell us more about that, and what is 3,000 in terms of robotic surgery? Is that a big number?
It is a big number, actually. 3,000 for all types of robotic surgery. So what's an advantage then with at St. Luke's Medical Center? We have full complement. Like we have urologic robotic surgeons, those specializing colorectal surgery, full complement. So like when you do an abdominal surgery, there are other organs. There are other organs to protect. Sometimes multiple surgeries. So we do that. So that's why I think that 3,000 is actually a big number already. And then, of course, with and the advantage of having full complement, we get to do more complex cases. Multiple cases in a single patient, we're able to do those cases.
What is I know you said there was a learning curve to this, but now that you've been there, and you, Dr. Marie, you've been doing this since how long ago?
We've started 2011.
2011. What is the learning curve for someone like you now? Or
Okay.
would say, I mean, meron mo bang expert na, or patuloy pa rin, it continues in terms of advancement?
I still believe that you shouldn't be stagnant. You shouldn't stop studying and learning.
Yeah.
Learning shouldn't stop. But then, of course, we've reached this comfortable level of experience wherein we get to do complex cases. And I've said, in St. Luke's, we are very fortunate to have also experienced colorectal surgeons, urologists, also we can call on to. So it's really an advantage. So there is a learning curve, but having 3,000, and it's a full complement, and there are all, a lot of doctors performing it.
Yeah.
I think we can say that we've passed the,
Is there such a thing as mentorship in robotic surgery? May ganun ba?
Yes, so we actually, majority of us are proctors in robotic surgery
What are
at St. Luke's.
proctors?
Just like mentorship.
I see, okay.
You teach we have there are several doctors at St. Luke's, gynecologic surgeons who are local and international proctors. So some of us would go abroad to teach, to train other doctors. So also nationwide as far as Visayas and Mindanao.
All right, so we mentioned a while ago that this St. Luke started this 15 years ago. Siguro it's good also to find out the perception of robotic surgery in the Philippines. I asked this a while ago, no, parang the advancement, how it has actually evolved through the years and now. Dr. Ado?
So before it used to be an experimental, but now it's already an established form of treatment. Okay, and again, people now, patients now are more welcome in terms of accepting, no? Because they've seen the clinical benefits, as Dr. has mentioned earlier. So there's really less blood loss. You have minimal small incisions. Post-operatively, you stay in the hospital much shorter, and you're able to return to usual activities quicker.
Did you experience patients who you really had to convince that this was the better way of doing the surgery?
Yes.
Okay.
From when it started. So actually, 15 years ago, of course, you came from abroad, training robotic surgery, and then you try to tell your patient this is the advantages of robotic surgery, and then the patient would, that time, not only one or two patients asked me, Doc, anong robot? Sino mag-o-opera sa akin? Yung robot ba? Sabi ko, of course, no, of course, I had to explain. So it was harder actually before. Now there is patient awareness, there's internet, and actually, it's actually all worldwide. Robotic surgery is being performed, not only by the gynecologists, but urologists, surgeons alike.
That's why we started the interview a while ago with people are wondering, is it a robot or is it working independently, or is that's why it was very important also to, of course they can research this, to make people understand what robotic surgery is and how, how it actually helps in surgeries. Another thing is that how do you ensure that Filipino OBGYNs are trained in robotics so that, more and more Filipinos are trained here so that the technology reaches even more women nationwide?
So in St. Luke's, we offer minimally invasive gynecologic fellowship training. And as previously mentioned, we do proctorship as well in order to propagate this mode of treatment.
And I'm sure they're so excited when you do that mentorship, no?
Yes. Oo.
Because, of course, this is the future.
This is
back 20 years ago.
Yeah. And in St. Luke's, we have established the first formal fellowship in robotic surgery in the Philippines.
Really?
Yes, so
Okay.
it's actually we have a training program. So that's actually our way to, propagate the practice of robotic surgery to the next generation of surgeons.
What about, possibly for women, those watching us right now who have been possibly even suffering from in silence could be pelvic pain or any heavy bleeding, pero natatakot po sila na pumunta sa OBGYN at magpa-check. What would you tell them?
You don't have to endure the pain. Huwag tiisin tayong, or we Filipinos, na matiisin talaga tayo eh. But go have that check-up. Go to your gynecologist, because there are many treatment options available. Who knows whether it might be medical or surgical. And if surgery is really indicated for this patient, then minimally invasive and robotic-assisted surgery will help you recover with minimal incisions, lesser pain, and quicker return to normal functions.
Doc Marie, same question.
How?
For those who suffer in pain, who are having experienced severe bleeding, but they're scared.
Yeah.
They're scared to see an OBGYN. They're scared to even find out what they could possibly have. What do you say to them?
Don't be scared, because, of course, early detection is better than, making it worse. Parang matiisin nga tayong mga Pilipino eh. But then, don't be scared. Even kasi in St. Luke's, we don't do surgery right away. So we have a check and balance. We have a quality of care is very important. Employing the standard of care. So even if you're bleeding, for all you know, hindi mo kailangan ng surgery, gamot lang. Or if you need attention, there are other modalities of treatment, not necessarily surgery, so they don't have to endure the pain, all their symptoms.
All right, just one last question, just anecdotally. Just can you share a patient's experience after a robotic surgery? Anyone that comes to mind?
Ako, I remember when I was starting, I had a patient na she had an ovarian cyst. She's probably in her 50s or 60s. So I was thinking it was a benign condition. So I did laparoscopy on her. So not eventually, when you had the biopsy result, it turned out to be a very early stage of cancer, but it's contained. So she needed a completion surgery. So the second time is actually she needed to do the robotic surgery. So the first one was laparoscopy, the second one was robotic. And then, of course, the second one was more major because it entailed hysterectomy. Then I asked her, how would you compare? Kasi na-experience siya both eh.
Yeah.
Kasi sabi niya, Doc, with robotic surgery compared to laparoscopy, the pain is less. Even if it entailed, it's more major, there are more procedures, techniques, and we do a lot of things with hysterectomy, but then her pain was less. So I think that actually stayed on me, and actually till now, although those cases naman very seldom do they happen, but then if you ask the patient, ang feeling nila is parang they had crunches also. How's your pain? One patient of mine, I asked, how's her pain? And then sagot niya, Doc, it's just like having 100 crunches.
Yeah.
Post-operatively. You don't see that in open surgery.
Very interesting. Maybe just last words, Dr. Ado, to those watching us today.
So St. Luke's Medical Center offers minimally invasive and robotic surgery. So see your gynecologist, get yourself diagnosed. There are plenty of treatment options available. So don't be afraid, go have your checkup.
And, very important, how often does one need to see their OBGYN?
Once a year.
Once a year.
Remember that.
Huwag kakalimutan. Always see. Well, of course, if you can get your executive checkup, hindi ba, isasama na rin doon yung OBGYN. Dr. Victoria Cruz-Javier and Dr. Maria Josefina Morales. Thank you so much for your time, and congratulations. I was going to say I hope to see you soon. I hope to see you soon outside the hospital. Thank you so much to both doctors. That's On Point. I'm Pinky Webb. Thank you for watching.